October 3rd, 2022, the committee is meeting on its study of the impact of the new rehabilitation contract award by the Department of Veteran Affairs on the role of the case manager and quality of service delivery. La réunion d'aujourd'hui se déroule sous forme.
Today's meeting is being held in a hybrid format in accordance with the motion of the House on 23 June. MPs may participate in person or through Zoom. I would take this opportunity to welcome a number of our colleagues. I have Peter Julian, who is replacing Rachel Blaney. Thank you very much. Chair, Ms. Gladue, who's replacing Fazer Tormi, and Mr. John Bassat, who's replacing Tori Dovelde. And also, for your information, there is Ms. Datin Seyaboyi, who is the clerk, and who is assisting our own clerk, and to ensure a smooth meeting, I would like to provide you with some information for participants and members before speaking. Wait to be called. If you are on video, please open your microphone and your video. You also have interpretation. And I recall that any remarks from members or witnesses must be addressed through the chair. In accordance with our routine procedures, I would like to inform the committee that all witnesses have undergone sound tests before the meeting. Before receiving our witnesses, I hope that the members have had a good week and participated in the Remembrance Day celebrations last week.
Our witnesses. From the Union of Veterans Affairs Employees, we have Virginia Vaillancourt, National President. Welcome. And Toufik El-Daher, National Executive Vice President. He will be by video conference. Vous allez avoir 5 minutes pour faire...
You'll have 5 minutes for your presentation. And normally I show you the 1 minute sign when your time is coming to an end. And so, Ms. Vaillancourt, over to you for 5 minutes. Go ahead.
Thank you for the opportunity to speak with you today. We have the privilege to represent almost 2,800 mostly frontline workers who have the honor to serve our veterans to ensure that they receive proper supports, timely decisions, and the benefits they need. The latest report from Veterans Affairs Canada shows that there are a total of 494 case managers positions on the payroll. 441 of those are indeterminate and 53 term positions. But positions are not people. From May 3rd to August 30th of 2022, VAC hired 13 case managers. During the same time period, 24 case managers left the department for retirement, resignation, or moved to other departments. Yes, VAC hired case managers, but still ended up with a net loss of 11 people. Another 90 case managers are on some form of disability, long-term sick leave, or other leave. That means we have less than 400 case managers to serve the needs of the veterans, of almost 15,000 veterans and their families. It shouldn't come as any surprise that we have lengthy backlogs, frustrated veterans, and psychologically wounded and demoralized staff. Veterans coming to VAC are often worried, scared, and usually sick and hurting, both physically and mentally. The role of a case manager is to listen to their story and guide them through a complex system when they may be at their most vulnerable. The ultimate goal is making sure that the veteran's transition to civilian life is as successful as possible. As you will hear from some case managers next week, this is not just another job. For most of them, it's a calling to serve those who served. Case managers fear that through the new rehab contract, veterans will lose their human, face-to-face contact with someone who will be an ally an advocate, and quite often a trusted friend to them and their families during some pretty dark times. Under the new contract, the contractor will be the lead in providing advice and guidance to veterans who require rehab services, not the case managers who have built a relationship of trust with the veteran. The contractor may find them a service provider, but who will answer their questions? Who will sit with them and their families to hear their stories and address their fears? Who will they turn to if things don't work out? The bigger question here is, do we want the face of service to veterans to be a kind, caring, and compassionate case manager, or a for-profit corporation who serves their shareholders? Over to Tawfiq.
Thank you very much. Can you hear me? Yes. Thank you very much, Chair. The new rehab contract has been problematic from the beginning. VAC claims that case managers in the union have been consulted. That is false. We received the contract a few days only before the contract was awarded. We named union representatives to various subcommittees, but they were seldom invited to the planning meetings. None of our questions and none of the direct questions asked by case managers were not answered. We wrote to the minister to meet and listen to our concerns. Twice he ignored us. The third time we wrote, he declined and sent us back to the department, who still haven't answered our questions. VAC initially held town halls where questions were encouraged. Then, when they couldn't give satisfactory answers, they shut off the chat function and stopped allowing questions. A few weeks ago, they held another town hall with case managers. Once again, no chat, and there were no questions possible. That is not collaboration. That is not consultation. None of the case managers' questions about their roles and responsibilities or how this contract would actually work have been answered. They have not even been fully trained on how to implement this contract. Given that, we have asked that the rehab contract implementation be delayed, and we hope this committee will consider that. We fully support the case managers on their recommendations to have VAC commit to a case ratio of 25:1. That is essential. We also need long-term funding for this department. No more temporary or stopgap funding. Our veterans are not temporary. They are veterans for life. Our union and our members are fully committed to serving veterans. They are our friends, our family members, our neighbors, our heroes. Our veterans deserve better. Thank you very much. Thank you very much for your presentation. We are now going to go to the first round of questions, and I would ask Mr. Richard to ask his questions. 6 minutes.
Appreciate you being here today. In what seems like a bit of a contrast to what we've heard from you today, in a statement to the CBC, the Minister's office indicated, and I'm going to quote, that from the beginning, Veterans Affairs Canada has had transparent and regular communication with staff. Case managers have been and will continue to be engaged in all phases of the contract rollout as elements are put in place. End of quote. Is that accurate? Do you find that that's been the case?
No, I do not.
Okay. Do you want to maybe just, I guess first of all, has yourself as the head of the union, have you had engagement with the minister? Has the minister reached out to you? Has there been any conversation between you and the minister about this rollout or about this process?
No, the minister's office has not provided an opportunity to meet with him to discuss the contract whatsoever. No.
You find that a little odd?
I do, considering his previous mandate from the Justin Trudeau specifically stated that he was to work with and including the labour movement. We've had absolutely nothing in regards to the contract.
I find it more than a little odd myself. It seems like it would be quite obvious that that should be something that should happen, that there should be engagement with yourself and those who are on the front lines in the department, with veterans themselves, with service providers, and it certainly appears like none of that's happened. Would that be your understanding as well? Like, have you had conversations with veterans and some of the service providers at all, and have they been engaged with by the minister?
No, they haven't. When we've talked to veterans, they're not sure exactly what's going on. They know that the department sent out a generic letter advising them of the change to the new contractor, but they still have so many unanswered questions. And when we met with the Legion earlier this year, they were not aware of the contract at that point. So engagement-wise with stakeholders, no.
Okay. And what about case managers themselves? What are you hearing from them? Do they feel like they've got adequate information about what's going on? Do they feel like they've been engaged in this process at all? And if so, why not? Why not? Like, what is happening?
So we've been talking to case managers for a number of months, specifically in and around the contract. We've been holding town halls. They don't know exactly what their role is going to look like when this contract kicks in on Tuesday next week. I was speaking with a number of case managers yesterday. They still have not received the process in which to refer clients to the new contractor, and this contract kicks in on Tuesday. That's kind of concerning that they don't know what their roles are going to specifically look like or how it's going to roll out specifically.
Yeah, that's concerning to say the least. I mean, we're talking about something that's supposed to start next week. And you're telling me that the case managers who are intimately involved in this process, clearly, and would have to be, don't have any idea what is going to happen, how this is going to roll out, what the interface is between themselves and the new contractors. That's a real concern. Do you see any way that this is anything but a failure in that scenario?
No, I think it's a pure failure. I've asked the department to slow the contract down, to back up a number of steps and make sure that the case manager's questions and concerns are dealt with, and to make sure that veterans are not going to fall through the cracks. But they have a contract to push through, and that's what they're going to do.
And, the case managers themselves, I mean, how are they feeling about this? Like, how do they see this process? I kind of looked at the job description for the contractor that they're hiring, and I kind of compared it to a job posting for a case manager, and they sure look a lot alike. So are case managers, how are they feeling? Are they feeling like they understand what their role is going forward? Because it doesn't seem to me very clear.
No, that's one of our concerns, is that the role of the new RSS is very close to and very similar to what the case manager's job is right now. So there's a lot of uncertainty about what their role is going to look like, what duties they're actually going to be doing. The department is stating that it's going to ease the administrative burden, but with this migration and transition to the new contractor, there's been nothing but additional administrative burden for them with transferring files, etc.
And what impact do you see this having on veterans? Like, it doesn't look to me like a very seamless process when even the case managers themselves don't have a clue what's happening here. How is this going to affect veterans? What impact will this have on them? What do you see happening there?
Well, the veterans that we've talked to and the case managers who we've spoken to have said that their veterans don't know really what's going on, and they are not able to provide answers to the veterans on what it's going to look like or how the transition is going to roll out. There's too much uncertainty right now for this contract to go forward.
And really with case managers, and that role is really to have a relationship with veterans, as I understand it. And in this process, is there a chance that relationship is severed, and that veterans, that there will be a negative impact on veterans as a result of this changeover, and not knowing, I would assume if case managers don't know, veterans themselves don't know, what impact will that have on a veteran?
So that's one of the case manager's biggest fears, the loss of the relationship. It takes a while to build a trusting relationship with a veteran to get them to open up, to verify what their barriers actually are. So not having that relationship is going to be a hardship for the veterans. Case managers are concerned that there's going to be a loss of trust, more of a loss of trust with the department from the veterans because of this uncertainty.
Thank you, Mr. Richard and Madame Vaillancourt. And now I'd like to invite Mr. Casey, Sean Casey, for 6 minutes, please.
Ms. Vaillancourt, on July 17th, 2022, you published a news release where you indicated that the union obtained confidential surveys carried out by the Department of Veterans Affairs. Do you recall that?
Yes, we do.
And that confidential survey, did you find that that contained accurate and comprehensive information?
I'll defer to Tawfiq El-Daher.
Please open your mic, Mr. El-Daher, and answer the question.
Oui. Désolé, j'avais pas.
Sorry, I didn't have my microphone turned on. Could Mr. Casey repeat his question? I didn't quite understand.
Ms. Vaillancourt issued a press release on July 17th, 2022, citing a confidential survey carried out by the department. My question is whether you found that survey to contain valuable and accurate information.
Yes, absolutely.
You would agree then that most of the employees were well informed about the PCVRS service contract.
Non, je suis pas d'accord avec vous.
No, I don't agree. The employees were not well informed about this contract.
Page 6, question 2. I am well informed of the changes that will take place with the implementation of the new Partners in Canadian Veterans Rehabilitation Services contract. 68% agree or slightly agree. Is that information incorrect and unreliable?
Ils sont au courant qu'il y a.
Well, they're aware that there is a partner that will be arriving, but they're not aware of the details about who the service providers will be. I mean, you can play with the figures or whatever you want about the percentage, but I can tell you that yes, we're aware that they're aware that there is a new provider. But they have said yes, they are aware, but that means nothing really. That this figure.
That most who responded to the survey reported that they understood the reasons for the upcoming changes?
The changes weren't very clear. We weren't really aware of what impact there would be on the case managers and the survey, the employees. They said whether or not there were some that said responded favorably. They don't understand what was going on. I don't understand why you're asking this. They don't really understand what impact there would be on the case managers, and they knew that it would be a negative effect. But the surveys, they're can be used differently.
With respect to the accuracy, reliability, and value of this confidential survey?
Excuse me, Mr. Casey and Mr. El-Daher, would you like to ask the question through the chair
Oui.
and the answer also, please? Thank you.
Oui, je le sais.
Yes, I'm sorry. Sorry.
Have you changed your mind since we started this conversation? Sorry?
J'ai pas changé d'avis, monsieur.
No, I haven't changed my mind.
Mr. Chair, I wish to ask the witness whether he has changed his mind since we started this conversation with respect to the accuracy and the completeness and the reliability of the confidential survey, which was the subject of their press release in July of 2022.
Absolutely not. I have not changed my opinion.
So if it's still your view that this information is accurate and reliable and form the basis for your public remarks in July, then you would agree with me that most people understood the impact of the proposed changes.
Il faut pas oublier non plus.
We can't forget that it's not all the case managers that answered the survey.
Is that what you're saying?
Yeah. Oui.
Yes.
Je suis désolé, mais j'entends très mal. Alors,
I apologize, but I can't hear you very well through my headsets.
Managers overworked?
Yes, they are.
Their caseloads are too high?
They have been, and they counter what the government's promise was of 25 to 1.
And therefore, it would be a good idea to get them some support in their work?
15 seconds, please.
It would be hiring more case managers, not contracting out the work.
So support from people who pay union dues.
Sorry, your time is over. And now I'd like to invite the second vice president of the committee, Monsieur Luc Desilets, pour 6 minutes.
Mr. Desilets, 6 minutes. Thank you very much, Chair. My question is for, hello to my colleagues, and first of all, what are the reasons for the minister's refusal to speak to you? To be honest, I don't know. Personally, Chair, since I'm in post as Vice President since October 2018, the minister's never contacted me. As a member of the National Executive, a representative of the employees of Veterans Affairs, I have no idea why I've never had any contact with him. Since when? Since October. I have had no contact with the minister. And Ms. Vaillancourt, when did you have last have a meeting with the minister?
Since I became national president officially in January of 2019, I've met with the minister in February of 2020 for 30 minutes, and again in December of 2021 for 30 minutes.
Sur l'actuel dossier.
So, on this file?
Initially, the February meeting was in regards to the case management numbers and the high workloads and the stressors that was causing. And in December, it was a follow-up to that meeting in and around, and we didn't have enough time to get into the contract piece. 30 minutes is not enough time to talk about the concerns.
Okay. Merci, Monsieur Albert.
Thank you very Mr. Albert, what will be the consequences or the impact of this contract on rehabilitation services? Chair, I work for my, I was a service agent for veterans starting in 2003. I see this contract as a very negative contract. It will be a very negative contract. Since 2006, I've lived through the privatization of our 15 health programs, even though the ministry said that this would be kept, and yet they opened up the program, and there is no program that would be staying within the ministry, and that's why I say that this is the contract can be modified at any time. Right now, it's for 5 years, and that can be extended. The major effect will be on veterans because they will no longer be able to deal directly with their case manager, and they will have to deal with a company or for an insurance company or another one. It doesn't provide the same impact for their services delivery, and they need direct contract with their managers, and it's not privatization that will allow us to provide adequate service for veterans. And why is it not will not be adequate? This is because initially we managed the 15 programs, whether for eye care or dental care. We managed them ourselves, and they wanted to save money, so they decided to close the treatment authorization centers in Montreal and elsewhere, and they transferred these contracts to Blue Cross. And this was in 2006 or 7, I think. And after that, we lost all those programs, in-house programs, and now I can see that there'll be more negative effects because veterans have difficulty with the decisions taken by these external companies, and often the letters are very badly written, for one thing, in French, and they're very cold, distant letters, and that's what worries me with this new service provider, that our veterans, what recourse will they have? Right now, with our internal systems, things are working well. There's no need to privatize. We just have to provide additional resources for the veterans, but it's not privatization that will solve the problems. According to you, is it monetary reasons, budgetary reasons that underlie this change? Of course, I think that whenever a decision or a treatment or something, a service is refused, then that's a savings, and these are services that veterans that sacrificed their own lives or well-being for protecting our freedom. And when we provide services to veterans, if they are denied services or denied the treatments they need, we have to help them. We help them provide the documents, negotiate the administration. And maybe a last question. The rehabilitation contract, what impact will that have on the working conditions of case managers? I'm afraid that the impact will be felt in 3 years when the $43 million will have been used, and there we'll see jobs that will not be renewed. And I'm also afraid of the impact on the current cases and current case managers. I'm very, very wary, very afraid for the future. Thank you very much, Mr. Albert. We are now going on to Mr. Peter Julian. 6 minutes. Over to you. Thank you very much. For Mr. Eldar, could you confirm that this survey referred to by Mr. Casey, I can see that there are 26 respondents, 24, 31. Can you confirm that number of respondents, and how many of your members does that represent? Yes, absolutely. Chair, we had 54 replies. In other words, about 9% of case managers, and that's why I tell you that That's barely the 67% result would be only about 9% of the managers. So I'm stressing there's a very small number of case managers who responded.
It has been nearly a year since you have met with the minister. How many requests have you made over the course of the last year to meet with him?
I've submitted 3 official letters to him that I know off by heart. There might have been about 5, but 3 for sure.
Okay, and you have not at any point had the minister meet the union that represents the vast majority of caseworkers.
No.
I find that stunning. I also find it appalling, outrageous, that in 120 hours, 15,000 veterans, many of them suffering from PTSD, many of them suffering from injuries, are going to be thrown into a black hole because it doesn't appear that the ministry has done any preparations at all. You mentioned no process, no training. Is it true that at this point there's absolute chaos anticipated in 120 hours?
The case managers absolutely feel that way, yes, and we feel and support them in their concerns. And that's why we want to speak to the minister, and he's just not willing to meet.
I find that appalling treatment of people who have put their lives on the line for Canada. I'm stunned by this. I'm subbing in this committee, but I'm just stunned by your testimony.
And we have to remember that some of our case managers are veterans as well. So they're seeing this from both sides of the field, and that's another concerning piece.
Now, you mentioned 15,000 veterans, less than 400 case managers because the government hasn't managed this department effectively at all. Is it true that that means that each case manager is handling about 40 veterans?
Right now, that's the average. We've had case managers count the cases because the department will state that they have a 30-to-1 ratio. Case managers are carrying 40 minimum, and some of them have as high as 60 on their caseloads.
That's unbelievable. I mean, you can have the best case manager in the world, but if they're handling 60 veterans, they have at best a few minutes a week for each of those veterans. I mean, that's appalling. What could $100 million in the ministry actually do in terms of increasing the caseworkers and actually providing for the effective management that is so important for supporting our nation's veterans?
Well, permanent funding is key. Having these temporary stopgap fundings are not helping. We need to hire more case managers in-house, and having that $100 million would easily provide the ability to hire more case managers and retain them in-house.
Are you aware in terms of the contract of what the profit margin might be? Because that, of course, would be a concern as well. When it is in-house, we have trained caseworkers that have a link, as you've said so eloquently, link, and have been working with those veterans for years and years. So they developed the relationship with adequate funding and appropriate management. They could be provided the supports that they need. When you take it out of house, then there are a variety of payments that the federal taxpayer picks up, including profit margins for private corporations. Are you aware of what the profit margin might be for this particular contract?
We don't know the exact profit margin, but we have sort of calculated out, and we estimate ourselves that it's going to cost about 25% more to have this contractor on board than it is to hire more case managers.
Yeah, and that's most of the examples in privatization. That's very similar to some of the examples we've seen tragically in other sectors. Are you aware of whether there are any penalties at all for non-compliance? I mean, is there even within the contract anything remotely close to the type of relationship that caseworkers already have with the veterans?
No, and the contractor will be doing their own quality assurance, which is really concerning when you have a contractor doing their own quality assurance of their work. But I don't see.
Sorry, you're saying the contractor is evaluating themselves? They're basically grading themselves?
They have the quality assurance. We have documentation from the department, from one of the town halls, that specifically states that the contractor will oversee the service delivery to ensure adherence to the contract requirements, accountability, and service excellence. This includes accessibility, timeliness, adherence to program intent, parameters, and the legislation.
So they get to grade themselves on the the quality that they're providing to veterans. And is there a duplication of services? It seemed very convoluted in terms of the contract, but are you going to see Veterans Affairs employees and then the contractor, with whatever profit margin they're getting, then doing again some of the things that have been done by Veterans Affairs?
That's one of the things that we're unsure of at this point, because we're not sure exactly how this is going to roll out, and what exactly the role of the case managers is going to be once this contract is in place.
120
Thank you,
hours from this,
Mr.
and we don't have any of those
Julian.
answers. So thank you for your testimony.
Mr. Julian, I'm sorry, your time is up. So, well, before we go to the next round, in order to finish at this panel at 4:30, I'm going to have to cut in 2 minutes the two last interventions. So we're going to have 5 minutes with the Conservative, 5 minutes with Liberals, 2.5 and 2.5 for both of you. And we're going to finish with 2 minutes for Conservative and 2 minutes, so because we have another panel. So right now, I'd like to invite Mr. John Brassard for 5 minutes, please.
Thank you, Mr. Chair. Good to see you again, Virginia. I'm just curious. I haven't been on this file in a while. How many of the Veterans Affairs offices that were ceremoniously reopened by this government across the country are actually functioning at 100% capacity right now, or they're fully open? Do you know, are you aware of that?
None of the offices are fully open. We do have staff going in offices based on a hybrid model, but there's still staffing shortages in a bunch of the offices. But the department will say that there's no vacant positions currently.
So they're not functioning at 100% capacity. 54 responses represents roughly 9% of the case workers. Can you give me some indication as to why there weren't more responses to that survey that Mr. Casey was referring to?
Well, we're not sure exactly who the department sent the survey out to, if it was to some of the working group subcommittees or not. That's still something that I haven't been able to confirm.
One of the things that the minister has talked about often in the House of Commons and in media reports is additional staffing that they said that they were going to hire. It would have been roughly, I'm throwing the number out there, I might be wrong, roughly about 380 more case workers. Have you seen an actual hiring of case workers to the amount that the minister has indicated in order to deal with the backlog in caseloads?
No, so to give you a little bit of history, in March of 2020, we had 34 term case managers and 455 indeterminate case managers. As of August 30th of this year, we have 53 term, 441 indeterminate, which means that there's 14 lost indeterminate positions there.
I believe you mentioned that in your comments as well. So fact is, we haven't seen the type of hiring that the minister and this government has promised in order to deal with the cases in the backlog situation, correct?
No.
Okay. So here we are facing a situation where we're going to outsource. Let me ask you something. Within your contract, do you have a contracting out clause within the contract of unionized employees?
There's stuff that's being worked on currently in the collective bargaining process, but not specifically to this, no.
No existing contracting out clause. One of the things that you mentioned earlier, that the costs associated with outsourcing of this company will in fact work out to 25%, or could work out to 25% more increase in costs. Now, the contract, I note, is for 5 years, $565 million, which is about $100 million a year. Realistically, what would it take if this contract was not to happen? What would it take in order to deal with the current crisis within the case management system within VAC? 100 million, 30 million, 50 million? Would it be less than what this contract is indicated for?
It would absolutely be less than what this contract is costing the Canadian public, absolutely.
Has the association done any calculation on that, on potentially? Because I'm going to ask a question of department officials, but I'm just wondering whether you have done any analysis on that.
We haven't done the full analysis. I have done some where, looking at the promise of the 25-to-1, we would need at least 700 case managers to meet the 25-to-1 that's been promised since 2015.
So this contract will, in fact, cost more money in order to administer the cases of backlogs and the case management system within Veterans Affairs than what currently exists right now, if in fact they were to take some of that money and apply it to it. Okay, thank you. This new company, are you aware through any of your contacts of how many veterans are actually working for this new company that can help and guide veterans through the process of rehabilitation?
No, we've seen a lot of their posters go out in that. We've also had a couple of the providers reach out to case managers and try and bring them over to the new
I bet they
service.
have. Yeah.
But no.
Because that's one of the things, and I know Mr. Richards talked about this, curiously, the job description for this outsourced company is the same job description as what is already existing within Veterans Affairs, yet the potential exists that it may cost taxpayers, and I don't like to look at it as taxpayers because that somehow infers or implies that we're not taking into account the needs of those veterans, but it's actually going to cost more money, and yet it's the same job description, correct?
Yeah.
Okay. I wanted to get into the relationship between the case managers and the veterans, and I know that in many cases it's a very personal one. Sometimes it can be acrimonious, but for the most part, case managers do develop those relationships which are important for the treatment and rehabilitation of those veterans and their families who are dealing with things. Thank you, sir.
Thank you so much, Mr. Brassard. And now I'd like to invite Mr. Wilson Miao for 5 minutes, please. Go ahead.
Thank you, Mr. Chair, and thank you for your appearance today. This contract was awarded in June 2021, and it's been over a year now. One of the main objectives of this contract is to streamline and reduce the administrative burden on case managers. Why do you not agree that this is the case, and what kind of impact are affecting the case managers since the contract was awarded?
So we never liked the streamlining aspect, and the department has been, as I said, noting that it's going to ease the administrative burden. We don't find that, and the case managers, as I said, have not seen that any less of an administrative burden. Right now, they're transitioning all of the files from one system to another system, and they're filling out a 6-page migration form, which is more or less giving the relationship of the case manager that they've built with the veteran to the new contractor. So that's how the contractor is going to learn about what the veteran's needs and that are, is through a 6-page document, where a case manager might have spent 5 months or more trying to build that rapport and relationship with the veteran.
Mm-hmm. Thank you. And the new service model should be reducing administrative tasks and allowing more time for case manager to communicate with the veterans and their family. Do you agree with this case?
No, because we don't know what the case manager's role is going to be when this contract comes in on Tuesday.
Okay. Mr. Chair, I'd like to share the remaining time with my colleague here, Mr. Casey. Yep.
Mr. Casey, the floor is yours for 3.5 minutes.
Thank you very much, Mr. Chair. Ms. Vaillancourt, I'm going to read something to you. Tell me if you recognize this. I continue to meet with senior management on various topics and concerns while working to build the collaboration and consultation between the department and the union at all levels. Do you recognize that?
You'd have to specify in which document that was, but yes, it's something that I continuously try to build, and the department will tell you that I am always harping on that there needs to be better collaboration and consultation between the union and the department, and it's not there.
You wrote that in your report to the members in September of this year, about a month before you called for the minister's resignation. So could you outline for the committee the steps that you took between May and August to build collaboration and consultation between the department and the union at all levels?
Well, it's not just the union's role to build that, it's the department's role as well to come to the table and actually collaborate and consultate, which hasn't happened. We've attended a National Labour Management meeting, which the department has taken away UVAE's individual NLMCC, which is National Labour Management Consultation, and has turned it into a joint meeting, and that's something that I've documented very clearly, that we need to go back to UVAE's specific meeting for that. So I meet with some of the senior managers every couple of weeks in a BILAT meeting, and I am always harping on consultation and collaboration.
You would agree that
Mr.
contracting...
Kessie, please address your question through me, please.
Mr. Chair, I'd like the witness to advise whether this idea of contracting out rehabilitation services is something new, or is it something that the department has been doing since 2006?
Thank you, Chair. The department has been contracting out other work, absolutely. The Medavie Blue Cross was prior to my term in the national office, so at that point I was a local president when that contracting happened out. Not sure what else you are looking for.
So with respect to what you reported to your members, I asked you about what steps you had taken to build collaboration, and you responded by what the department hasn't done. Can you take another try and tell me what you have done as per your report to your members?
As I noted in my response, I have BILAT meetings with senior officials every couple of weeks, and at those meetings I'm trying to build the consultation and collaboration piece, which does not fully happen.
Merci, Madame Vaillancourt. Nous allons...
Thank you very much, Ms. Vainqueur. We'll have two short questions. Mr. Didier, 2.5 minutes. Thank you. A question for Mr. Allaire. You know that the Francophones feel that they are badly served by the delays in their responses and their services. Do you think this change could have a negative effect on Francophones? Based on my experience, Chair, I would say yes, because we can already see that Francophones wait longer to get responses to their requests for indemnities, and I think that there are more Anglophones than Francophones that are hired, and I fear that Francophones will pay the price, and our veterans and their families will pay the price for this privatization. With regard to the workload of case managers, according to the union, there should be only 25 per manager. And what is the average, or most of them are how many? Well, the 25 to 1, that doesn't come from the union. It comes from the ministry, from the department. And the previous minister, it was really the ministry, the department that imposed this number, and so the department doesn't even respect its own criteria for workloads, and so 25 to 1 is to ensure better contact with the veterans and to better assist them. And very quickly, why do you think it's so difficult to meet this 25 to 1 ratio? Well, because there's a lack of staff everywhere. There's a lack of training. There's also a problem of retention within the ministry, and there's not a great deal of recognition given to the to employees. There's a lot to be done by the department to recognize staff and to retain staff, and this is one of the failings, which means that we have a difficulty retaining our employees, and this is something they want to work with the department on, because what is the priority? To give the best services possible to veterans and their families, and we know that we have resources, and we want to increase the resources available, but not through privatization, and we want that our personnel work for the veterans. Now, Mr. Julian, for 2.5 minutes. Ms. Vaillancourt.
Disturbed by what I'm hearing from you and from the union. 120 hours we're throwing veterans literally into a privatization experiment. I'm really stunned by this. I wanted to know what the transition plan had been up until next Tuesday. Is it true that case managers were told not to offer any new medical or psychosocial resources for veterans starting on October 25th?
Yes, that is true.
So the department cut off for veterans that might have PTSD, that might need urgent support. The government cut off those supports for a month?
Yeah, the case managers were advised from October 25th to November 21st not to implement new medical or psychosocial resources, whether they were on the current VOC rehab, whether they were new rehab applicants, or whether they were already with the case managers being shifted.
What would be the consequences of that for somebody who has PTSD and is suicidal? What would be the consequences of cutting off those services?
Well, I'm not a veteran, but I come from a veteran's family, and I can tell you that it has a negative impact on their ability to reestablish effectively. This is where we have concerns that veterans are going to fall through the cracks. I know for a fact that some case managers have still been putting in the resources because they said, I don't care at this point, my veterans need this resource and it's going in place.
So you have some caseworkers disobeying a government that cruelly is cutting them off from essential services.
Yeah, and we know that they will most likely get called out for it, but for them, it's about the veteran. It's about making sure that the veteran has the services and the benefits that they need, regardless of waiting for a contract for a for-profit company to be put in place.
Now, the government is refusing to put money into veteran services and instead wants to hire this private contractor. Is the fact that there are so many temporary workers in veterans affairs, is that something with no permanence? Does that contribute to an instability in terms of providing the supports that are so necessary for veterans?
It does, because you have case managers who aren't sure if they're going to have a job at the end of their term, so they're constantly looking for that permanency, and a lot of them have looked to go to another organization or go back to the community.
Thank you,
and ministers
Mr.
refuse to
Julian.
sit down with you to talk about that.
Thank you, Mr. Julian. And now for 2 minutes only, I'd like to invite Mrs. Marilyn Gladue. For 2 minutes, please. Go ahead.
Thank you, Chair, and thank you to the witnesses for being here today. I'm extremely concerned with what I'm hearing. Just following up on Mr. Julian's comment there. So are you saying that if a veteran had called in the last month with PTSD, with suicidal thoughts, that the government had instructed case managers to not refer them to anybody to help?
Yes, I have flip charts that one of the offices put up for the case managers, which specifically outlines the 3 different steps for that, and it specifically states no new medical or psychosocial resources from October 25th to November 21st. And I'd be more than happy to send the committee chair those flip charts.
Yes, please send that to the committee. As a follow-up, on Tuesday, veterans are going to be calling, and my understanding is that you've said you have no idea where to refer them, and they got a letter that doesn't really tell them who they need to talk to. Is that correct?
That is correct, and as I said, I spoke to a number of case managers yesterday just to see where they were at, and as of yesterday, they did not have the process to refer clients to the new contractor.
This is entirely unacceptable. How much time do I have left?
Less than 1 minute. Take it all.
Oh, I'll take it all. Great. So in terms of the communication that's gone out about how this process is going to be rolled out, can you tell us the details of this phased rollout?
There hasn't been much of a sort of phase. There's been deadlines, which I requested through the Deputy Minister to move because of the amount of work that case managers were under. That request to move that deadline was denied. And then when the department found that they weren't able to meet that deadline, they changed the deadline themselves. And this was for the case management complexity or assessment tools. So the pure phase, I'd have to send you the document because I don't want to misquote something.
That's fine. You can send us the document. And what about veterans that are trapped in the backlog? What will happen to them on Tuesday?
10 seconds, please.
I do not know.
Thank you, Mrs. Vaillancourt. Et pour les 2 dernières minutes,
And for the last 2 minutes, Mr. Casey. 2 minutes.
Mr. Chair, in response to questions from Mr. Julian and Mr. Broussard, it appears that you now have some concerns over the sample size of the confidential survey. Has the union done a survey of its own that's more comprehensive?
We have done surveys previously, not specific in regards to this contract, no, because we don't want to overburden the case managers right now. We're trying to help them, not hinder them.
So your account today is based on anecdotal conversations and the confidential survey?
I wouldn't call them anecdotal, no.
What would you call them if you don't have a scientific survey?
Even when I don't have the surveys directly with me, but when we've done surveys and that, and we've taken those statistics to the department, they don't trust the information that we've gotten from the case managers. Mm-hmm. And these are directly from the case managers. We're not pulling this data out of ourselves. We're not making this up. These are through town halls, conversations, surveys, and face-to-face meetings that I've had with case managers across the country.
Okay. And your preoccupation expressed in response to your questions from Mr. Broussard and Mr. Julian, that didn't really enter into your thinking when you referred to and relied upon those surveys in your press release of July 2022, correct?
Sorry?
So you thought enough of the department confidential survey to issue a public statement about it in July, right?
It's a document that the department put out, so yes, we're going to reference it.
Yeah. Okay. You've mounted a campaign, a public awareness campaign around this contract, and have you approached the Legion to see if they would join with you in concerns and critique of the contract?
We met with and talked to the Legion previously, and as you've noted, you'll have seen the Mercedes Stevenson, where the Afghan Vets of Canada specifically joined and called out for the removal of the minister due to the lack of work that he's been doing on this file.
Thank you. Thank you.
I haven't specifically asked the Legion.
Thank you, Mr. Casey. And je voudrais...
I'd like to thank, on behalf of the members of the committee and myself, I would like to thank you, Ms. Vaillancourt, and from as the president, national president of the, and also Mr. Eldaher, who is the executive vice president. And thank you for your contribution and for the services you provide to veterans. So, members of the committee, we will suspend for 2 minutes very quickly to allow our next witnesses to enter. Thank you. now go to our second panel.
Reminder to our witnesses that before speaking, please wait until I recognize you by name. But if you are on video conference, please click on the microphone icon to unmute yourself. And I would like to inform the members to, first of all, address the questions to the chair. And I would like you also to say to who would you like to answer your question, because we have 3 people there and 3 on the Zoom. And now I'd like to welcome our witnesses. From the Department of Veteran Affairs, we have Stephen Harris, Assistant Deputy Minister, Service Delivery Branch, Jane Hicks, Acting Director General, Service Delivery and Program Management, and Natalie Pham, Senior Director, Operational and Strategic Affairs. And on the Zoom, we have from the partners in Canadian Veterans Rehabilitation Service, Monsieur Gilles Chabot, or Gilles Chabot, Chief Operating Officer, LifeMark, Ms. Tanya Bennett, Chief Executive Officer and Executive Sponsor, WSG Services, and Ms. Paulette Gardiner-Miller, Contract Manager. So let's start with the Department of Veterans Affairs. So you will have 5 minutes for your introduction, and after we'll go on the Zoom. So, Mr. Harris, the floor is yours for 5 minutes or less.
Merci, Monsieur le Président.
Thank you very much, Chair, members of the committee.
Thank you for the opportunity to provide this committee with an update on new rehabilitation services and case management services at Veterans Affairs Canada. The military experience of every veteran is unique. Rehabilitation is a critical component for veterans who need additional support. Le programme de réadaptation est conçu.
The rehabilitation program is aimed at supporting veterans, their families in their transition towards civilian life, both at home as well as in their community and their workplace. The program offers access to personalized rehabilitation services aimed at meeting the particular needs of veterans at the medical, the psychosocial, and professional levels. This is one of the programs offering services and advantages in the context of the overall case management of veterans.
Veterans facing complex challenges. It's a collaborative process between the veteran and the case management team to identify needs, set goals, create a plan to help participants, and achieve the highest level of independence, health, and well-being. Case management is and remains a core VAC service. In fact, we've made investments over the last 2 years to reinforce and expand case management practices, including tools, processes, and reducing caseloads so case managers can meaningfully engage with veterans and their families. Furthermore, the Government of Canada has confirmed $43 million in funding over 3 years earlier this month to support these services. This funding will maintain the total number of frontline VAC staff, including case managers, and help improve the case manager to veteran ratio and the tools they use. Nous veillons également à la mise en œuvre des...
We also ensure the implementation of other long-term initiatives, including the program for professional rehabilitation service and the renewal of the case management, which will contribute to reducing the workload of managers, in particular with regard to administrative tasks linked to file management.
Rehabilitation is administered by one contract, while medical and psychosocial rehabilitation services are delivered through multiple providers through a second contract with Medavie Blue Cross. The expiry of the Vocational Rehabilitation Services contract in December 2022 provided the department with an opportunity to improve upon the rehabilitation program and the way that we deliver it. ACC a consulté les gestionnaires de cas,
The department consulted case managers, veterans, their families, industry experts, and the employees' union throughout this renewal process and the implementation of the contract. Their opinions, concerns, and points of view have helped us define how services, rehabilitation services, will be offered through this new provider.
Veterans have told us how they would like rehabilitation services to be delivered, and we've listened. The current program delivery, with 2 distinct contracts, places a heavy administrative burden on case managers. This time is spent finding multiple providers for each veteran, educating them on the program, gathering reports, and scheduling appointments. Case managers have identified that spending more time directly working with veterans and their families is a priority. A 2019 survey from the Audit and Evaluation of Case Management Services reports that approximately 73% of case managers spend 50% or more of their time working on administrative tasks. Ce nouveau contrat de réadaptation.
This new rehabilitation contract was awarded on 30 June 2021 to Partners for Rehabilitation Services for Canadian Veterans, a business of WCG International and Lifemark Health Group, which ensures the coordination and administration of medical services, psychosocial and professional services available to veterans and other participants eligible under the Department Rehabilitation Program.
Means having rehabilitation-focused services that are coordinated, nationally consistent, quality assured, performance measured, and include advanced technological supports. These enhancements will improve the veteran experience and their well-being by offering a more holistic rehabilitation program where veterans have the best chance to achieve their goals and adapt successfully to life after service. Pour la première fois, les vétérans seront...
For the first time, veterans will be able to consult and print a copy of their rehabilitation plan. They can also ask for payments online, see the list of their next meeting appointments, and use a secure messaging system to exchange with their specialists and other professionals.
Time spent on administrative work. Case managers can instead spend time engaging with veterans on other supports that they may also need as part of their overall well-being. Case management services and resources will continue as an essential service delivered to veterans and their families by case managers. There's no job loss as a result of this contract. In fact, the commitment to case management is key for the minister, including his recent announcement of $43 million of additional funding for case managers. Merci. Happy to take your questions.
Merci beaucoup, Monsieur Harris.
Thank you very much, Mr. Harris. And now we will move to from Veterans Rehabilitation Services.
I am Tanya Bennett, Executive Sponsor for Partners in Canadian Veterans Rehabilitation Services, or PCVRS. And joining me are my PCVRS colleagues, Gilles Chabot, who's a member of the PCVRS executive team, and Paulette Gardner-Miller, who's our dedicated contract manager. And we're extremely pleased to be here today to share information related to this very important topic. Partners in Canadian Veterans Rehabilitation Services is an innovative partnership joining long-serving organizations in Canadian rehabilitation and vocational services. In fact, our partnership was created for one specific purpose, and that's to deliver high-quality rehabilitative care for veterans through the Contracted Services for Veterans Affairs Canada in the Rehabilitation Services and Vocational Assistance Program. Our organization and our qualified health and vocational professionals from across Canada bring the knowledge and expertise to meet VAC's requirements for the program. And I'd like to tell you a little bit more about who we are. Our team has many years of experience providing a comprehensive range of evidence-based medical, psychosocial, and vocational rehabilitation assessments and services across the country. We have deep experience working with veterans, and we've developed tried and tested methods to deliver high quality assessments and rehabilitation services that will help veterans transition to post-service life. PCVRS is a mission-driven team with a shared culture and values. We are committed to enabling veterans to live better lives through effective, personalized rehabilitative and vocational care. Our focus is on helping veterans and their families successfully transition to post-service life and to achieve their potential in all areas of well-being. We're on a mission to ensure participants of the program achieve optimal levels of health, functioning, and participation at home, at work, and in their communities. And we have 4 key values for our foundation of care for veterans and their families. The values in our CARE, or our care model, are compassion, access, respect, and excellence. Our approach puts veterans first. We show compassion for those we serve and build trusting relationships based on integrity and kindness. We remove barriers to access to services by providing a wide variety of in-person and virtual services in both English and French, and accessibility is embedded in our technology and our service delivery approaches. PCVRS provides Canada-wide coast-to-coast coverage through a network of thousands of medical, psychosocial, and vocational rehabilitation services professionals who will provide services through in-person care as well as virtual options. We provide and nurture an inclusive environment that is free from discrimination, is respectful, and is considerate of the unique experience of each veteran, spouse, common law partner, or survivor. We have embedded gender-based analysis plus principles into all aspects of our service to advance equality and inclusion for veterans of all backgrounds. We provide training for our team members to support specific veteran communities, including the Indigenous veteran population. We strive for excellence in all we do and will collaborate as a partner to continuously improve the participant experience and to enhance rehabilitative outcomes. Our Partners in Canadian Veterans Vocational Services team has been created to achieve our mission to enable better lives for veterans. We take a team around the participant approach, and we look forward to collaborating with VAC case managers to deliver our contracted services for the rehabilitation program. And this is important as we understand VAC case managers are the delegated VAC decision makers for rehabilitation plans. In closing, we are honored to deliver a professional and supportive rehabilitation service for Canadian veterans. Veterans and their families deserve high quality, accessible, and inclusive health and well-being services. And that is what PCVRS is committed to delivering. Thank you, Mr. Chair.
Oh, Ms. Bennett. And now, comme vous le savez, nous avons...
As you know, we have another in-camera session which will begin at 5:20. So I believe we have 30 minutes. So I will give 5 minutes to each party. So you can decide amongst yourselves who will be asking questions, or rather, sorry, 6 minutes. 6 minutes, I should say, per party. So I would ask you to designate someone or decide how you're going to share your time. So I'll begin for the first 6 seconds. Point of order.
You correctly, you're going to allot each party 1 6-minute slot, and that's all. That'll
Exactly.
Be the entirety of the questions.
Just a round of question of 6 minutes each.
Can I ask you, should there be a few minutes remaining before the time scheduled for in-camera business, that we could divvy that up and give each party another minute or two if need be?
Very good. Okay.
If it's possible?
Yeah.
Okay.
Okay, perfect. So let's go for 6 minutes. Mr. Blake Richards.
Okay, I'll try to be quick because I know I have other colleagues who want to ask questions as well. Can I start maybe with the folks from the Partners in Canadian Veterans Rehabilitation Services, whoever it is that's answering. How long has the Partners in Canadian Veterans Rehabilitation Services been in existence?
Thank you for the question, Mr. Chair. Partners in Canadian Veterans Rehabilitation Services was formed specifically in relation to this this contract and this service. It was developed for that, so it was during the procurement process.
Okay,
I think it was probably.
I'm really limited on time, so I'm sorry I have to cut you off because I don't have a lot of time to use here. You've given me a sense of the answer that it's just been created for this purpose. Can you then tell me the workers that will be interacting with veterans from your organization?
Yes.
Can you tell me what are their qualifications? What's their training and what's their experience? Obviously, when we're talking about dealing with our veterans, and with their families, there is a very different scenario than there would often be in dealing with insurance claimants and things like that. We're talking about veterans who obviously in many cases there are some significant operational injuries, including psychological injuries. What is the training and experience and qualifications of the people who will be interfacing with veterans to do that, specifically with regards to working with veterans?
Thank you. Thank you for that question. Mr. Chair, I'll speak about some of the qualifications and invite my colleague Paulette to give some details around the training. In terms of the qualifications, the rehabilitation services specialists who will be working with veterans are regulated health or vocational rehabilitation professionals who have experience in coordinating and delivering medical, psychosocial, or vocational rehabilitation services. So they're professionals with experience who are regulated, have the appropriate designations credentialed. So typically we'll have like social workers and other health professionals. Paulette, could you provide some more detail,
Sure,
please?
and if I can ask you to focus in on what training do they have and what experience do they have in working with veterans and their families? I need to really, that's what I really need to understand.
Great.
Certainly. From a training perspective, PCVRS has evolved subject matter experts, and we have an instructional design specialist to help us put together training modules specific for the group that we are proud to.
Can I interrupt you? What I heard you say is that you've engaged someone to help you design a training model. This is supposed to start next week. These people will be working with veterans starting next week. Are they trained or not?
I'm explaining what's happened over the last year and a half.
Sorry, I misunderstood you. It sounded like you were saying that you were just beginning that process.
No.
Okay.
No.
So tell me where they're at right now. I don't need to know the process over the last year. Just where are they at?
They're complete, and we've got great feedback from veterans that we've had take a look at it. Some of the areas, and I agree with you that this population has specific needs. So some of the areas that we've included in our training is unique to military culture, barriers, and how to support transition to post-service life. Certainly mental health awareness, including understanding the mental health continuum, moral injury and operational stress injury, mood disorders, anxiety and trauma-informed disorders like post-traumatic stress disorder, which we've heard about earlier today, substance-related disorders.
And all of the employees have been trained in these. And I'm sorry to be cutting you off, but I'm only given so much time here, and so I need to make sure we get through everything we need to get to. They're all trained. Everyone that we're working with veterans has been trained in all of these things that you just outlined?
The areas that I just described will be mandatory for everyone who is involved in treating participants in this program.
So when will they all be trained?
Some will have already started and others won't have yet because we haven't launched.
So there will be people working with veterans starting next week, correct?
We will start the process of doing our initial assessment and then getting them set up. So everyone will be trained as they are beginning their work with the veteran population.
Okay, so okay, and what about experience? Would any of your employees have experience working with veterans?
Yes, certainly.
Okay. For the department officials, I do have some questions for you. First of all, though, if I can, you're probably aware a motion I made in this committee asking for documents related to the standard operating procedures for recording calls between veterans and veteran service agents, as well as between veterans and case managers. Would you be willing to provide that to the committee by, say, I've asked for it within 48 hours, maybe by next Tuesday? Could you provide us with your standing operating procedures by next Tuesday?
We could certainly provide that, yes.
Thank you. If you can get those to the clerk, that we would appreciate that. Now, if I can go to the issue we're dealing with today, in this process, I see there being sort of three key people here. Obviously, veterans and their families, first and foremost, are clearly the priority here. But I think also we're talking about those who work for the department now, who are going to see some changes to what happens with their roles, and also I think service providers who could be impacted, obviously, in this changeover as well. And I wanted to just get from you a sense of what has occurred in terms of communication between the department and each of those three key stakeholders, particularly starting with the veterans.
Yeah, in 15 seconds, please.
Jane, do you want to?
There's been significant consultation over the past 18 months. We've had a series of consultations with employees. We've had 6 town halls over the last 18 months. representation of anywhere between 400 and 800. We've also had communiques with veterans through Salute magazine. We've had consultation with stakeholders.
Thank you, Mrs. Hicks. Thank you, Mr. Richards. Time is over. It's over 6 minutes. So I have to go to the round. Is that? Oh, okay. On the web, on the Zoom, Mr. Darrell Sanson, you have 6 minutes, please.
Thank you, Chair, and welcome to all the witnesses here with us today. I'll start off with the department very quickly. We heard testimony earlier from the union that there has been no consultation with case managers through this process. Can you share a little feedback on that quickly?
Yes, there's been consultation. First of all, as we started the implementation period, we set up a series of working groups that had members from the union, from various groups, and they've been involved informing the implementation process. We've also had 6 town halls, and most recently, we had 6 Q&A sessions for case managers with about 450 participants the week of October 31st to share information, provide feedback. We've also set up a portal for case managers to answer any of their questions. We've had over 300 questions responded to over the past 12 months that they've shared with us. So that's just kind of gives you a sense of some of the consultation.
Thank you. Maybe Mr. Harris, you talked about case managers' workload, the administrative task that they had prior to this contract. Can you speak about that? What would be a percentage, would you feel, of administrative work that they were doing then that would not have to be done now?
Thanks for the question. And again, a case manager's role involves much more than just the rehabilitation program. They are the linchpin of contact for veterans working with the department in terms of reestablishment and rehabilitation. The rehabilitation program is just one. So within the rehabilitation program, however, they were tasked with a whole host of administrative responsibilities in terms of coordinating appointments, finding service providers and others that they will not have to do. They will not have to chase reports to be able to help serve and support their veteran clients. And so in this case, when the contract goes into place, it'll be a significant reduction in the administrative elements of what they're responsible for.
Thank you, Mr. Harris. The union seemed to indicate that in their opinion, it was the same job, what caseworkers are doing and what the new company will be doing. Would you agree with that? Same mandate?
No.
Thank you. As far as the company, our new company, of course, that's been contracted out, I understand that you have veterans would have access to 9,000 individuals to support them. Can you expand on that, please?
Thank you for the question. Mr. Chair, I think it would be great if Gilles could provide our response on behalf of PCVRS.
Thank you very much, Mr. Chair. Yes, we have in excess of 9,000 practitioners across the country who have experience in providing rehabilitation services. Some of these clinicians that work with us directly include physiotherapists, occupational therapists, psychologists, physicians, chiropractors, massage therapy, kinesiology, social workers, clinical counselors, as well as vocational professionals. We have over 20 years of experience in providing comprehensive rehabilitation services to Canadians, including veterans, across Canada. We also have over 600 physical locations to help support and provide access to our veterans. We have an extensive affiliate network.
Sorry, Mr. Chabot, but did you say 600 locations that would be available?
That is correct.
Can you just give us a quick rundown in each province? Like just general numbers, don't have to be exact, but just an idea.
I don't have that at my fingertips, but I would be very happy to provide a breakdown for you across the country.
Is there representation nationally right across the country?
That is correct, yes.
Okay. So you were talking about the 9,000 that we have access. So how would veteran access those services?
I think I can take
Yes, thank you.
that question. Yes, thank you. So after the that case manager confirms eligibility, then the referral would come over to PCVRS. At that point, they get assigned an RSS who'll do the initial assessment to determine, what are the barriers, what needs are there, and then with the participant, the VAC case manager and the RSS, work together to build the rehabilitation plan. If there are any consultations required in order to do that, medical assessments, vocational assessments and such, that would be provided and then worked into the decision making in terms of moving forward. And at that point, if everybody agrees on the rehab plan, then the care would be provisioned to the veteran.
So the veteran will be involved in that plan, in developing that plan with the company, so they have a direct line. Can you expand on that just a bit?
Well, the veteran is the center of everything that we're doing. We certainly need to involve them in understanding their specific individual needs, and they need to be engaged in all the planning, as well as if the veteran chooses their family, so that we're best serving their all-around needs.
So what type of services would be available as well? The same services to veterans' family as with veterans as well?
That might be a better question from an eligibility perspective to our VAC colleagues.
Maybe I'll go to Mrs. Bennett. Mrs. Bennett, you spoke about it's a new company, but you also spoke about all the work and experiences over 20 years with veterans. Can you kind of link that together? Because it might be a new company as amalgamation, but there's a lot of great experience, expertise. Could you just quickly touch that?
Mrs. Bennett, in 10 seconds, please, a quick answer.
Thank you. We are two organizations that have been delivering rehabilitation and vocational services in Canada for over 20 years, and we've come together to form a joint venture to deliver this contract.
So this is just not a new company, but
thank you, Mr.
Sanson.
Thank you so much. And now I'd like to go to Mr. Desilets for 6 minutes.
Mr. Desilets, 6 minutes. Thank you very much, Chair. First question for Ms. Bennett. For you, this contract is aimed at what? Saving money, improving services? This is always a way of improving services and to engage experts in rehabilitation, and case managers will work with veterans to evaluate their needs, and the rehabilitation is a more specialized function, and that's why we will work with the contractor to ensure that the veterans receive the best possible services for rehabilitation. So you believe that this contractor will provide improved or superior services? Yes, for a long time we've had contractors who provide physical rehabilitation. Now we have medical and psychosocial providers, and we simply want to reduce the administrative burden and to ensure that since veterans need various methods and routes for support, we want to meet their needs and to provide activated support. Is the ministry saving money with this move? No, I don't believe so. We want to provide better service and ensure that we have experts to provide these services. So earlier we heard that from 25 October to 21 November, there were no psychosocial services offered to veterans. Is that true? No, that's not true. I'm going to ask my colleague to answer with regard to the process. So veterans who are already in the rehabilitation program will go through the migration to the medical social to the new program. So there will be services that will be maintained during the migration. No services will be stopped. And when the people arrive in the program, I would like to point out the case manager will take decisions with regard to eligibility and needs, and with regard to psychosocial assistance, nothing will change. It's just the rehabilitation services, which will be evaluated over a period of a few weeks before defining the final plan. But there hasn't been a memo sent to the unions or the personnel with regard to this process. We did provide information to the case managers to tell them that the services treatments would be continued, and during the migration, and if the psychosocial will not continue for a brief period. But you say that you want to remove some of the administrative burden from case managers, and the 9,000 people that are working on these files. You're going to have these new 9,000 people that will be offering social services and other services. This is both. We have health professionals amongst the 9,000, as Mr. Chabot said earlier, and we will also have physiotherapists, psychotherapists, and others. And there will also be some employees or specialists in rehabilitation who will work to ensure all the rehabilitation needs of the veterans are met. And this new resource, this new way of providing these services, this restructuring, will inevitably make for loss of jobs for case managers. No, I don't think so. I don't know, Jane or Natalie might want to intervene, but the experts in rehabilitation and the case managers will be assisted. Our case managers, their central function will maintain to work with veterans and to create links with care providers and to coordinate the provision of services, and they will approve the care decisions, and our partners are specialized. Our managers have the overview, and they will reach out to specialists to help us and our veterans, and this will be part of the responsibilities of case managers, as you know. So this is like a bank of 9,000 people who will be available to offer services. But unlike what we heard before, do these people actually have any expertise in working with veterans? I think the important thing is that we expect that there will be expertise with veterans through coordination and with other providers. They have a more specific expertise with the medical problems. But yeah, so they're already working with veterans. Are they already working with veterans in many of the cases? Many of these 9,000 individuals already working with veterans. Now I would like to call on Mr. Peter Julian for 6 minutes.
Merci, Monsieur le Président.
Thank you very much, Chair.
Back to this issue of no new medical and psychosocial resources from October 25th to November 22nd, 2022. We have a copy of a slide in part of the training that was offered through Veterans Affairs that says exactly that. I'll quote it: no new medical and psychosocial resources from October 25th to November 22nd, 2022. Will you provide to the committee all of the copies of the slides that were presented to employees in Veterans Affairs?
I haven't seen that slide, and Natalie, I don't know if you want to talk about, as you did, the direction that was given.
Well, no, I want to specifically ask, will you provide copies of the slides of what was provided to employees to this committee?
Sure. Yes, of course.
Thank you. My second question then is related to the minister meeting with the union. Can you confirm that the minister has not met with the union president for nearly a year now?
I can't speak, unfortunately, to the minister's meetings with the union. You'd have to ask with the minister.
My third question is related to the issue of the current casework load that most employees are carrying. Caseworkers, we've heard in testimony, are carrying anywhere from 40 to 60 veterans, and we know how important it is to provide the utmost services to veterans. Can you confirm that that is indeed the case?
In fact, that's not correct. The average is about 30 to 1 for case managers respective to veteran workloads. There are differences, and it does change over time. And in some cases, with new case managers coming on, they may have a reduced caseload as they build up their skills and competency. In other cases, there may be periods of time where people either have limitations or different abilities in terms of being able to deliver a caseload. So the average caseload is about 30.
Okay. How many caseworkers are on leave right now?
I believe Ms. Vaillancourt offered some issues earlier. I think it is somewhere in the neighborhood of about 60 for any variety of reasons. Could be maternity leave, could be family-related leave, could be education leave, could be illness.
Well, I mean, just doing the figures, if that figure is right, you're basically confirming the union's figures, which means a case workload of at least 40 veterans per employee. Can you provide us with figures to the committee as well that would give us a sense of what the case workload is currently?
Most certainly. I think Ms. Vaillancourt didn't provide any information around the fact that, yes, while some people leave, either for new jobs or on illness or maternity leave, for example, people are replaced too on a short-term basis in term or acting opportunities to ensure that they're able to support veterans and make sure that we can continue with the balance in the caseload.
What percentage of caseworkers are temporary?
Well, we have 50 temporary caseworkers now that are on.
Or indeterminate?
For 3 years. The indeterminate number for caseworkers for us is 426.
Yeah, okay. Well, I think that does
And
confirm
50
the figures that
temporary.
you provided. As far as the contract is concerned, what is the anticipated profit margin or net income to the company?
I can't speak to the percentage of income. What there is there's two elements to the contract. One element of administration, in other words, the work they do as part of what was just described to support veterans. And then there's also what would be considered the payments to the providers in terms of health, medical, psychosocial. So if a veteran, as part of their rehabilitation needs to go and visit a psychiatrist, that's paid through the contract as well.
What are the penalties for non-compliance by the company?
I'm not sure offhand that I have the penalties in front of me, actually.
Could you provide the contract to this committee?
I'm not sure that we can provide the entirety of the contract because there are some elements that are proprietary in terms of basis of payment and some others.
I mean, that would be
the statement of work is available and was available as part of the contractual process.
Yes, I'm asking you for the contract, though. Would you be providing that? Could you provide that to the committee?
I will work with my team to make sure what can be released and what is not proprietary as part of that. Yes.
Mr. Chair, I'll be providing a notice of motion at the end of this meeting. Can you confirm that essentially these companies are conducting quality assurance themselves? They're evaluating themselves in the contract?
That is one element of it. Of course, they would provide quality assurance of their own services, and there are metrics that they have to provide back to the department in terms of quality assurance that we would also be reviewing as well. So, of course, as part of their own internal work, they do quality assurance to ensure that their staff are delivering quality services. There are also metrics and measures and performance measures that they need to give back to us as the department to be responsible for the oversight and provision of the contract.
But you don't recall what the penalties are for non-compliance of those service requirements?
I don't have penalties in front of me, unfortunately, no.
Okay. I'm going to move on maintenant à la question du bilingue.
Now, a question for Ms. Bennett. What is your experience in offering services in French?
Mr. Chair, we have significant experience delivering critical human services in French, both in employment services contracts throughout Canada and also in delivery of vocational assistance services for VAC in current contracts and previous contracts. So we're the current contract deliverer for the vocational rehabilitation aspect of the rehabilitation program, and that's a program that we offer and provide services in French And we've been delivering that contract since 2015. And even prior to that, since 2009, the precursor contract.
Pour une francophone, quel est le recours?
So,
I'm sorry, 6 minutes, it's over. So, comme on avait discuté...
As we said, there will be 1 minute per member. We'll have 4 members. Ms. Rosenthal on Zoom for 1 minute.
Thank you so much. Mr. Harris, I assume that you're familiar with the Auditor General's report that we just studied at committee that indicated there was a complete lack of ability to determine whether or not service delivery was being done properly. There were no metrics, and there was a great deal of concern about that report. So you're familiar with it, yes?
I'm familiar with the report. I don't know that that was in
Right.
the entirety of the conclusion.
Okay, so is that part of the reason why we're looking at this company doing its own performance measurements? And what do you have that you could provide to this committee that indicates what your intentions are in determining the quality assurance?
Sure, I'd be happy to share information with the committee about how we will ensure quality assurance on this one. The Auditor General's
Do you have
report,
it in writing? No, excuse me, sir. Do you have it in writing?
quality
I would like to
assurance
receive
and
it.
performance metrics, yes.
Right. Okay, could you provide that to the committee, please?
Yes.
Okay, thank you. As well, you know, we have $560 million going to this venture. That's 101, almost 102 million per year. I look at that and see that we could easily employ the number of case managers required,
Mrs. Morgenthau,
as well as
sorry, it was
train
only
them.
just 1 minute, just a quick question, so I'm sorry.
Oh, that was such a short minute.
Exactly, I know, because we have in-camera meeting
Appreciate
right
it.
after. So I'd like to invite Mrs. Richie Valdez for a minute, please.
Thank you, Mr. Chair. My questions will go to VAC officials. Earlier, we heard from the union that they fear that veterans will lose human face-to-face contact. They fear the loss of relationship. Can you provide your response to that?
I would say the intention is the opposite. Having a contract will allow the case managers to have more time engaging, building relationship, doing the follow-up with their veterans, having those meaningful discussion and moving forward. And that is the intention that we have been working on from a case management perspective, and this contract will contribute to that.
Thank you. Who manages the QA of case files?
The quality assurance of the case files, we have different levels. So there's managers that are doing quality assurance from a job compliance, and we also have our case management unit that do the overall QA.
Thank you, Mrs. Valdez. Et maintenant, Monsieur Desilets, 1 minute.
Mr. Desilets, 1 minute. Thank you very much, Chair. My question for Ms. Bennett. What other major organizations do you work?
WCG, the company that delivers as part of this joint venture, we have contracts with provincial governments throughout Canada to deliver important employment services, as well as I mentioned earlier, we have the current CVVRS contract with Veterans Affairs Canada for the vocational services aspect of the rehabilitation program.
À l'intérieur des 9 000.
And among the 9,000 resource persons you have, how many of them are from Quebec?
Thank you, Mr. Chair. I will invite Gilles to respond to that.
I'm so sorry,
Yes, thank you.
Ms. Bennett, because it's just a few seconds left, so you can send the information to the clerk and we'll give it to the MP Desilets. Thank you so much. And now, for 1 minute, Mr. Peter Julian.
Merci beaucoup, Monsieur le Président.
Thank you very much, Chair.
The motion for our next meeting, that Veterans Affairs Canada provide to the committee a copy of the contract for rehabilitation services between VAC and partners in Canadian Veterans Rehabilitation Services by November 25th, 2022. That's notice of motion, and I'll be giving you, Mr. Chair, a copy of that for our next meeting. I am really concerned when I see in testimony that we've heard $14 million a year provided to Veterans Affairs Canada, $100 million, over $100 million a year, going into this contract. It strikes me, particularly given the lack of preparation for the transition that takes place in 120 hours, Mr. Chair, that we are showing profound disrespect to our veterans. The government has not prepared the grounds on this, and the government has obviously money for engaging private firms. That money should be invested in Veterans Affairs, and they deserve, all our veterans deserve the highest quality of service possible.
Thank you, Mr. Julian. So, well, it's over for this panel. So, j'aimerais au nom des membres.
On behalf of the committee and myself, I would like to thank our witnesses for their participation. And today we had the Department of Veterans Affairs, Mr. Stephen Harris, Assistant Deputy Minister, Service Delivery Branch, Jane Hicks, Acting Director General, Service Delivery and Program Management, and Nathalie Pham, Senior Director, Operational and Strategic Affairs, and online. We had the partners in Canadian Veterans Rehabilitation Services. First of all, Tanya Bennett, Chief Executive Officer and Executive Sponsor, WCG Services. Gilles Chabot, Chief Operating Officer, LifeMark. And Paulette Gardiner-Miller, Contract Manager. So once again, thank you for your participation. I will suspend the meeting to allow for the transition to an in-camera meeting. And I would like the members on line to change to the new connection that has been provided to you.
you.